I will start first with giving you the meaning of our name. COEHA stands for Center for Occupational and Environmental Health Africa. I'm so happy to talk to you today. I'm going to tell you a little bit about the center, about our mission, about our work. We're located in Kigali, but we work in most of East African countries, Kenya, Uganda, Tanzania, and we have been working with 10 countries in different capacities across the Middle East and across Africa. What we do in general, our core function is training, is education, research, capacity building, as well as consultancies. And as the name says, we work on occupational health. This is a very small field, yet very effective. And there is a huge need now for this specialty. So, of course, we have our work and partnership with different governments, as well as different universities and different partners continentally and regionally. The biggest partnership we have is with the African Union. We have a lot of focus areas, but our core function is to develop the skill of occupational health locally in Africa. When we started, we were targeting only African countries and African professionals, but the gap is really huge, and our clients now is spanning in Africa as well as in the Middle East. So, in a summary, what do we do? What is occupational medicine? You see, Africa is booming now. You cannot talk about construction, you cannot talk about mining, oil and gas sectors without mentioning Africa. Africa is getting big in that, and although all those fields, they have a lot of opportunities for Africans, yet they bring a huge and an array of problems. Those problems, they can be solved, they can be attended to if you know them and if you have the skills and the expertise to deal with them. We bring that, we fill this gap. We move from just complaining about the problems associated with mining, with construction, the incidents, the accidents, and all the negativity related to those fields. We bring solutions. We give you solution of what to do. As companies, you wanna provide service, you wanna give back to your community, but there are some problems you need to deal with. Those problems are related to the health and environment of your community, and you need to attend to. So we give you that solution. We give you how to protect the health of your workers, the health of your communities, and the environment around you. This is for private sector. Another problem we identified is there are no trained doctors, nurses. The community doesn't know. The community always talk about the negative effect of say mining or construction, but they don't know what to do, how to deal with those problems. And instead of just fighting back different companies causing the harm, you can have solutions. You can give them solutions of how to help you, how to do that safely to the environment and to the community as well. So here we come. We give you the tools and the language that you use to talk with companies, your governments, on how do you want to have this safely done in your communities. Now we impart on something called Occupational Health Media Fellowship. We teach people working in media on how to present those issues, those problems, but also tell them how to reflect those issues, how to talk about solutions, how to talk about opportunities, and how to shape policies. So this is a 6-month program. We have journalists, content creators, movie directors, and different kind of media people working with us across Africa, from Senegal to Uganda and from Sudan as well. And we will have them soon here in Kigali, and this is one of our flagship projects. Now, going back to our dear doctors and nurses, people who want to be occupational physicians, or they want to have like some knowledge about what is occupational health, what do we do, and how do we take small short courses to develop smaller skills that can work for us, or you want to be a full-blown occupational physician or occupational nurse. We help you reach that with the connections that we have with different universities, different professional bodies. We do that as well. The last part is the research as well. You cannot talk about education and change and policies without having research. We do research in those areas. Research is an integral part of what we do. Look, you cannot talk about policy change, you cannot talk about services without having evidence supporting this. In Africa, we lack research in occupational health in general, but we are in a dire need. We are filling this gap as well. Occupational health is based on policies, regulations. Many countries, they have those regulations fragmented and in different ministries, in different bodies, if they existed at all. So for us, we help different governments as well as continental bodies like the African Union, for instance, to deal with those problems, to come up with policies tailored for the African context. Instead of just like bringing policies from elsewhere, we have our own problems and we should have our own solutions. We help developing those solutions. Being in Kigali, this is our host country, this is our place, and there is a lot need to be done here, and there is a huge community in Kigali. So we develop programs to help our community here as well. We believe health is a continuum. Like, you cannot talk of the workers is not a separate entity. He is a father, he is like maybe a son, a mother, with all the problems associated with that outside the work office or the workplace. We provide the support for that. Like, we care for the health of the workers inside and outside their workplace. We have a special focus on people who are above 55. We have a program called Silver 55. This is taking care of the health of our community who is above 55 years old. This is a very specific group of people that are transitioning from their work to the retirement. And we believe now things are changing. The retirement definition is changing. You hardly find someone who is retired. Everyone is working in different capacity now. But because the definition of occupational health is like very central to workplace, but we don't believe in that. We believe in the continuum of care. So we care about their wellness and their health outside workplace. So we have Silver 55. Check our website and other outlets to tell you more about what is Silver 55 and who we are targeting and how you can use this service from COEHA.